Access to healthcare should be a human right. I think that immigrant communities provide a lot for California, so I think we're at a time where California should start providing for immigrant communities.
Community advocates, a state politician, and news media gathered Friday for a briefing on the state of California's healthcare enrollment. According to the numbers so far, there has been considerable success since health reform kicked in.
We had 1.4 million people enroll in covered California. We had upwards of 2.7 million total be deemed eligible for Medi-Cal. That's a real success story, that we had that many people newly enrolled in coverage.
But the numbers also show that many of Californians are on track to still be left out if current policies stay in place. That includes many of California's immigrant populations who don't have access to any healthcare coverage.
Of that sort of roughly 3 million remaining uninsured folks, we expect that between 1.35 million and 1.5 million will be undocumented.
Como yo que tengo diabetes, que tengo artritis, y podemos amanecer con dolor. No tenemos ninguna cobertura médica, no podemos ir al doctor. ¿Qué es la segunda opción? Solamente quedarnos en casa, tomar una pastilla para el dolor. En este tiempo estoy esperando por una cirugía de un quiste de pecho por 2 años.
As an undocumented Californian myself, I think I've been here since I was 3 months. I haven't had a proper medical visit since I was 7 years old, and even at the time it came at a huge expense to my family.
But some undocumented persons have been able to receive coverage under the new reforms, thanks to the Deferred Action for Childhood Arrivals program, known as DACA. Many immigrants can receive California's state coverage, known as Medi-Cal.
And so I finally got DACA, and so I was able to finally get insurance, and I was finally able to see a doctor. And so once I got health insurance, it felt like such a relief because there was hope, and with hope you could do a lot of things with hope. And so I was hopeful that I was going to get better, and I unfortunately got the healthcare that I needed, and I got better.
And there is also hope for the rest of Californians undocumented. State Senator Ricardo Lara was on hand to discuss how his Health for All bill will also include coverage for all immigrants. He is planning on reintroducing the bill next year.
We are now at the state level pushing healthcare for all, which will create a statewide exchange program and expand Medi-Cal to include our undocumented community. We know that it is costing us billions of dollars in the state to care for our undocumented community through our emergency rooms. And so we know if we're able to give them an option so that they can have access to healthcare or pay into an exchange program, it's going to cost us less money in the long run. We're going to have a healthier community, and we're going to be able to ensure that we cover everyone. Access to healthcare is really the civil rights issue of our generation.